Back edema is a serious ailment that should not be messed around with. In fact, Jerry Culver of Central Nebraska Home Care certainly knows a lot about. He's joined us now to talk more about symptoms and treatment for this big-time illness. So what, first of all, Jerry, thanks for being with us. Sure. What causes this edema, this swelling, and sometimes severe swelling in our joints?
There's a number of causes, Seth, but let's kind of define it first. It's a buildup of fluid in the body tissues, in the extremities, and there's a number of causes for that. One of the things that I want to make sure that this kind of swelling or fluid in the tissue is not normal and that you should seek medical attention. Talk to your doctor about it because it could be a signal of something more serious going on. There's congestive heart failure can cause it. Pulmonary edema is caused from right heart failure. Kidney disease can cause this. Cirrhosis of the liver, high altitude, pregnancy, and certain medications can also contribute to peripheral edema.
In the legs, in the fingers, peripherally, you've seen that as well. Some pictures can be unbelievable. You can press down a finger, and then that indentation remains within on a leg. It looks really painful. And
it's usually not.
It's usually not.
No,
okay.
But it looks kind of strange, and there's a picture of it right now. The symptoms are enlarged ankles, calves, and legs may appear puffy like that. Sometimes there's discomfort. Sometimes your legs will feel tired. There's a decrease in elasticity because of that fluid is pressing against the skin.
Most of the time, senior citizens dealing with this. I noticed pregnancy, obviously, is you could deal with edema, but
sure, not necessarily. I mean, I don't consider myself to be a senior citizen just yet, but I have a little bit of edema. And you know, sitting behind a desk a lot can cause those kind of problems.
Sure.
When I get home and take off my socks, you can see where the indentation from my socks, and that can be easily treated with compression hosiery, and that's kind of what I'd like to talk to you about today.
Yeah, let's jump right in. Okay, what do we got here? And some of them are stylish colors.
Sure, you bet. You can get compression hosiery in just about any color to match your outfit, which is kind of nice. And they come in styles for both men and women, and they come in different lengths and different pressures. Now, depending on how much fluid is there and how much pressure is required to drive that fluid out of the extremity is determined by what your doctor will prescribe in terms of pressure. They start out at pretty low pressure, and you know, the companies really recommend that anything over 20 millimeters of mercury should be prescribed by a doctor. However, these products don't require a prescription other than the TED products now does carry a cautionary label that it needs to be prescribed by a physician.
Jerry, what about back here? What do we got?
Well, this is kind of a handy aid to help people put the stockings on. The higher the pressure, the more difficult it is for a person to get this on. Okay. So you stick your foot in here all the way down and get your toes down at the bottom, and then you just pull up on this, and it pulls up over your leg, and you can get your stockings on that way.
Isn't that something? Very nice, Jerry. Okay, we're out of time. Edema, something to talk to your doc about if you battle it.
Absolutely.
All right, thanks so much, Jerry Culver.